Hi everyone, my name is Jessica Farrell. I'm a clinical pharmacist at the Center for Rheumatology in Albany, New York, and an associate professor at Albany College of Pharmacy and Health Sciences. Today I'm going to be demonstrating various injectable products that are used to treat rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and other rheumatic diseases. Before I get started, I just wanted to disclose that I have no personal, professional, or financial relationships with any of the products that are being demonstrated today. So, I'm going to talk about injectable methotrexate. Injectable methotrexate comes in very small vials, so the injection process can be a little bit tedious and a little difficult for patients that have trouble using their hands, any dexterity issues, or any joint deformities. So I'm going to go through a step-by-step approach on how to draw up a dose from a methotrexate vial. The first step for any injection technique is to make sure that you have a clean space and that you wash your hands. So you can use soap and water, or you can use hand sanitizer. I have my fake skin here, so this can be an example of using your thigh or your belly. The best place to do subcutaneous injections on yourself with these medications is the thigh, an inch or so above the knee, in the central area of the thigh, and the belly. An inch away from the belly button is ideal, and I would avoid the pant line just because if there's any rubbing or irritation, that just can cause some pain at the injection site. So the first step is to take an alcohol swab. Alcohol swabs are available over the counter at the pharmacy, or you can use a cotton ball and a bottle of alcohol if that's easier. You use one swab to clean the injection site. So if this is either your thigh or your belly, you can do a couple circles, or you can just do a couple swipes. And then you want to let the area dry. The next step is to take your methotrexate vial, and if this is the first time you're using it, it will have a little plastic cap on top. You just want to flip that top off, and then that can be discarded. It won't go back on. The next step is to clean the top of the vial. So you're going to just do one swipe on the alcohol swab on top of the vial to make sure any residual dust or dirt or anything is not there. You can use the same alcohol swab if you don't want to use two. Just make sure that you're using opposite sides, either on your thigh and then the opposite side on the vial. When you get your methotrexate prescription, it will come with syringes. So these are very tiny syringes. They are sometimes referred to as TB syringes. They can hold up to 1 ml of liquid, and the needle is very small. So open that up. There are various different types of syringes, so they might look slightly different than this. These ones, you just have to be careful because the needle can sometimes come apart from the syringe, so you want to make sure that it's on there snugly, and if you have trouble getting the cap off, which sometimes happens, you just need to hold the bottom plastic part with your finger and pull off the cap. So, because this is a pressurized system, we need to put in a little bit of air to be able to get medication out. So, let's say that you are starting with a 0.4 milliliter dose of methotrexate. That's equivalent to 10 milligrams of medication, and it's once weekly, so on the same day every week. So you want to pull the syringe back to actually about the 0.3. So if you put too much air into these little tiny vials, it creates too much pressure and the medication might squirt back out on you. So you want to do about half or a little more than half of the dose of air goes into the vial. So if we're doing a 0.4 dose, we'll be putting in 0.3 of air. You want to go directly into the center of the vial, and you can keep it on the table, and you can press the air into the vial. Then you can flip it upside down, and you can just let it hang there. And what you're going to do is pull back. And as you pull back, you'll see a little space of air and a little bubble. So you just push it back up until you don't see that anymore. Then you're going to pull down, and if you keep getting that little bit of air, Just push it back up and just keep pulling back down till you get to your dose. Once you get your dose, you'll see no air bubbles. This vial has been used a few times, so you might notice that the liquid is really close to the bottom. So when you're getting close to the end of the vial, sometimes it is hard to get that last little bit of dose out of there. You're going to flip it back up, and you're going to take the needle out. So now you have your 0.4 milliliter dose in your syringe. You're going to take the area that you had cleaned off with the alcohol swab, and you're going to pinch the skin, and you're going to go in at a 45-degree angle. So 45 degrees, and then you're going to, you can let go of the pinch, you can keep it pinched, either or, and then you're going to slowly press the syringe and inject the medication into the area. Just like that. Go nice and slow, then you unpinch, you pull the syringe out, and then you should have a sharps container, or you can use a coffee can, and the entire syringe just goes right into that sharps container, that red box, or a coffee can. Medications that are injectable should be disposed in a sharps container, so if you don't have one, talk to your doctor about writing a prescription for one, or you can pick one up at the pharmacy. Most doctors' offices don't take sharps containers for disposal, but most local hospitals do. There are different sites in different areas that do have sharps disposal, so you can talk to your provider about that. And that's it.